All right, so back for part three. We talking about, you may not be able to see that. We're talking about sort of stress and the immune response. Um, Again, what this all boils down to is that stress, which activates the fight or flight system, creates this increase in cortisol in the body, and often creates behavioral changes like increase in risky behavior, dangerous behavior. Ultimately feeds into this system to create a change in your immune response. So, in essence, the increase in stress causes a decrease in our immunity, making us more susceptible to different diseases. And so that's complicated. We're not going to go into that too much. It's talking about T cells and lymphocytes and all those types of things. But all you really need to know is that the stress decreases our body's ability to fight off illnesses, and it increases the likelihood that we're going to get sick, which is why you get sick more often around stressful times or for big events or finals weeks or what have you. Um, so the stress pretty dramatically and quickly alters our immune function, which means we don't need um, in order for it to have an impact, stress doesn't have to happen for a long period of time. Stress can sort of immediately change or impact your susceptibility to disease. So stressors that come up quickly, or deadlines, or someone calling you with some stressful news can sort of immediately trigger that sort of immune response in the body and make your immune system sort of overactivate. It fights its own cells, and it makes us less likely to be able to fight off external illnesses. Your book talks about rheumatoid arthritis and how that works. It's sort of the flare-ups are triggered by stress and the body's immune system sort of attacking itself. So again, this can happen pretty quickly. We talked about some examples earlier, but to go into a little bit more detail, AIDS is one of the diseases that we look at very commonly in terms of both diseases that are exacerbated by by chronic stress, and also diseases where the risky behavior that we use to cope with stress is often a trigger or a direct cause of the disease. And increasing the risky behavior, in this case unprotected sex, or using needles, or other ways that you contract HIV. So in 2012, we had 34 million cases. This is a disease that's on the rise. So if we were to look at this again, we would see an increase in numbers. The good news is that our medications are getting better in terms of treating this, and so we have seen an increase in lifespan for people who have HIV and AIDS. And the median time from infection to full-blown AIDS is 7.5 to 10 years. Again, that is increasing. So we're getting more time between people contracting HIV and then developing AIDS. And the health problems occur after HIV infection. So you start to have health problems even before you get full-blown AIDS. And one of the ways that we treat AIDS is to work on stress reduction, because we know that these folks are very susceptible to getting diseases. Their immune system is compromised, which makes it more likely for them to get pneumonias or colds or other things that may be minor in some people, coronavirus. That may be minor in some people, but would be very deadly, potentially deadly to a person who is immunocompromised. So we work on identifying stressors and stress reduction programs, things like meditation or mindfulness, learning deep breathing techniques. I'll post some so you all can kind of look at some of the meditation and relaxation techniques that we might use. But what we see is higher stress and low social support speed the disease progression. So the more stress you're under, the less support the more deadly AIDS is. So we're reducing stress, we're improving immune system functioning as a result, and also trying to improve socialization and just general well-being. But it's very interesting to look at. Cancer, very much the same thing. And I know that the screen's probably cut off on the top there. But one of the things with cancer that plays a role is this perceived lack of control and inability to control the scenario. If you've ever had anybody in your family who's had cancer, you know that it can be sort of overwhelming and stressful for not only the person but for the entire family. And we just don't have the coping skills to deal with it. A lot of people who get the diagnosis are in denial. It is in itself a very stressful life event. It can create sort of this cascade of problems as a result. And often people who have risky lifestyles are more at risk here. So again, smokers are at higher risk. People who are overweight are at a higher risk. Like certain cancers that are linked to like HPV, like cervical cancer, which are essentially sexually transmitted in nature, can be attached to more risky lifestyle choices. Although that one's arguable because that HPV affects so much of the population that it seems like it's contracted whether or not you practice any sort of safe sex or not. But regardless, like it is linked to behavior, not specifically to lifestyle per se, but where was I? Lost my train of thought. Anyway, and psychological factors are also involved in chemotherapy. So the treatment for cancers and increased social support and outlook on life, things like that, are do play a huge role in whether or not those treatments are successful. Breast cancer, you throw that in there. It has obviously a huge psychological component. It's a very stressful event, very life-changing event, and women with low self-esteem, low body control, low feelings of low control, and lack of optimism, and lack of support were more likely to benefit from education and educational intervention. So education about the disease progress, because they were not getting that type of support in other arenas. And so we supplement that with just education about the disease and the progress. People who have better self-image, better body image, and some feeling of control are more likely to be successful with treatment with this. But we can somehow, in some ways, build this in by education about disease and disease progress. Very similar thing with heart disease. Hypertension is very much tied to stress. High blood pressure is tied to stress, and particularly chronic stress. And hypertension is a major risk factor for stroke and heart disease, also kidney disease. Causes this ongoing wear and tear on the blood pressure. So essentially what you have is a situation where chronic stress creates this lifelong change on your body in terms of the impact that it has on your cardiovascular system, on your blood vessels, on your heart. It affects a quarter or more of all adults, 29% for everyone over 18. African Americans, higher risk. People who take in more salt is affected by like chronic sympathetic nervous system arousal and stress. So directly linked to stress in your life. And people who are angry or hostile and for type A personalities are more likely to have cardiovascular episodes. So this is a disease that is very much directly linked to stressors in your life. Oops, I went too far. Let's see. I've talked about that already. And in terms of psychological and behavioral risk factors. You have stress and anxiety, anger. Generally, people who have poor coping skills are at higher risk for being stressed out, having chronic anxiety, but also having higher risk for or having poor social support, and also engaging in risky behaviors, bad eating, bad diets, poor exercise, smoking, drinking, all of those things that are side effects of living this type of lifestyle and can contribute to your increased cardiovascular risk. And again, type A personalities, people are higher in anger, have more negativity, tend to be impatient, they don't like to wait around, talk fast, walk fast, work fast. They tend to be at a higher risk. And these people have more chronic anxiety. Again, we will take a break there and we'll come back probably later tonight with